number 3, what is it?
It's a huge no-no. Don't ever do it.
There's a lot of photos and videos that I've seen. Young men and women, they look like they have shark teeth.
It's surprising to most people.
It is. And honestly, it was surprising to me when I got into dental school and I learned about this.
Welcome back to the show, everyone. Top 7 things you should never do to your precious teeth.
That is the question here. The topic of conversation.
It is.
Some might say the title of this video.
Oh, you got a good point. You have a good point. I like the excitement. And we should be excited because these can potentially be life-changing tips. These are conversations that we have on a daily basis with our patients. So stay tuned till the end to find out the most severely damaging thing that you're doing. Number 7.
Rinsing after you brush your teeth.
It's surprising to most people.
It is. And honestly, it was surprising to me when I got into dental school and I learned about this. And I can totally understand where someone is coming from when I'm educating a patient and I'm telling them for the first time in their entire life, hey, you shouldn't rinse your mouth after you brush your teeth. Why is that?
One of the most important components of your toothpaste is the fluoride. And the fluoride needs time to rebuild parts of your enamel. If it loses contact time with your teeth immediately after you rinse, it can't do much.
Think of this as a little builder.
Yeah.
And then you're washing them away.
Now, if you can't tolerate the feeling of that toothpaste there, you could try fluoride mouth rinses. There are other rinses out there that you could coat your teeth with.
Yeah.
We want you to be comfortable, but that is a good tip to maximize on protecting your teeth.
Yeah, exactly.
Okay. A follow-up question might be, but Dr. Han, I don't want to swallow fluoride.
That is true. There is such a thing as fluoride toxicity, but it's at such a high concentration. I think it's around 5 to 10 grams of fluoride
Per kilo, yeah.
per kilo that you have to ingest in order for it to be lethal. Spit, don't swallow. Thank you.
Oh boy. Number 6. We're getting a little bit more severe now.
A little bit. Yep, definitely. And I do know of people that do this thing.
What is it?
Brushing with activated charcoal or some sort of like lemon juice, baking soda mixture in order to whiten their teeth.
That's a pretty long, pretty long category. Yeah. So you explained it in the category. People are aiming to achieve aesthetic results, which is admirable. Now, why can this be a problem?
So charcoal is known to be abrasive. Just a little bit abrasive, and you don't want it brushing.
Well, it could be more abrasive than a little bit abrasive. We just don't know.
Right. Yeah. There's not a lot of research that has been done, especially long-term trials dealing with charcoal toothpaste. But what we do know that it is some level of abrasiveness, and you don't want to wear down your enamel.
If you lose your enamel thickness, you're exposing more of the dentin, which is the second layer, and that has color to it. So you want that enamel thickness. You want to keep that healthy, so that you're not exposing the colorful second layer. Let's take a quick lunch break from the dental education and talk about one of my favorite topics. It might be yours too. Food. If you've been following this channel, you know I'm a huge proponent of good nutrition and making healthy daily life choices. So I'm excited to introduce to you a convenient service that saves me time and energy on a daily basis. CookUnity. CookUnity is the first chef-to-consumer platform that connects you to a group of talented chefs in a regional, what they call micro kitchen. It's a place where all the meals are freshly prepped. From there, you get to choose any of the signature dishes that the chefs come up with. You order on a weekly basis and it gets delivered to your door. You can choose from over 7 dietary preferences, including gluten-free, paleo, vegetarian. You can explore, you can create combinations as well. So with CookUnity, you can enjoy healthy and delicious meals like Chef Esther Choi's chicken teriyaki with charred broccolini, Chef Raimundo Arguazo's lemon rosemary chicken with grilled asparagus and mashed potato. This one's bomb. Another thing I like about CookUnity is their flexibility with the subscription plan. You can pause, skip it. This has been working out well for me. It's not just piling up in my kitchen. So if you're looking to simplify your mealtime, that's cookunity.com/JohnU50 for 50% off your first order with CookUnity. As always, no pressure. It's just one of the tools out there that can help you get into a healthy, easy routine. All right, now back to the show. This next one is gonna be juicy. What is it?
It's gonna be veneers/crowns without a proper treatment plan.
What we're addressing here is this scenario. I don't really like this little spot here and this thing here, maybe I should just fly over to this other country and get 8 crowns because I saw it on TikTok. That's what we're trying to address here.
Right.
What's the problem with that?
I don't know if you guys have seen it, but there's a lot of photos and videos that I've seen of young men and women. You know, they look like they're in their 20s and they look like they have shark teeth. And those shark teeth are called crown preps. In order to place the crown on, you need some space to do that.
Yeah.
So the teeth, the outside of the tooth just gets shredded off. And now you're just left with a stub. That's irreversible damage in order to place that crown.
You can get some beautiful results with 8 crowns on your anteriors or your front teeth. Hollywood smiles are created with veneers, crowns, orthodontics. These are all possible options. What you have to consider is, are you knowledgeable about the long-term maintenance of these things? If you're a dentist and you have that conversation where you say, okay, when I'm signing this paper, I know I'm getting these crowns that require a lot of good hygiene, maintenance, possible redos.
Yeah.
These are all things that we don't want you to be surprised about.
Yes, yeah.
Because the last thing that you want after getting 8 crowns is pain, sensitivity, complaints with your dentist because he didn't tell you this stuff. It's a sensitive topic because we are in this field and we're providing dental care. We want everyone to be happy with their treatments, but ultimately we want you to be informed
Yeah.
about your care. Number 4.
Number 4 is going to be using your teeth as tools. I can tell them my secret.
What is your secret?
Okay. I used to be an avid nail biter. Every time they reach this length. But at the end of the day, after doing it for so many years, you have the chance of fracturing that tooth. And that's actually what happened with mine. And that's the little secret. My bottom 2 teeth. My bottom 2 teeth, they're chipped right there. Because of that, I do have like a little bit more sensitivity there too.
Oh, okay. So while we're on the topic of revealing our secrets, my secret is that I've chipped my front tooth 2 times when I was a kid.
Wow.
Do you remember back in the day, they used to have a twist cap for the Gatorade bottles?
Yeah.
I'm not talking about the bottle cap. I'm talking about the little mouth nozzle that turns and it opens.
We're from different generations.
Different generations. You're trying to get smacked. Okay, if you know what I'm talking about, I'll put a picture right here. Jack's too immature to know. But I used to open that with my mouth because it would be more hygienic than taking my dirty baseball hands
Okay.
and opening the cap. So I would do it
Yeah.
with my teeth.
Right.
And I fractured it twice. I actually had a feeling. Those are seemingly innocuous habits. Personally, I see a lot of teenagers, especially, biting on things just for fun. The problem is, if you're putting stress in the wrong direction, you can create microfractures, which are
Right.
small fractures that you might not even see. So take it seriously. It's a small thing that can turn into a big problem.
Do you feel that?
Do I feel what?
Storm is brewing, bro.
The
This is getting bad. This is getting bad.
That's so cheesy. I can see you doing that on dates. It's like,
Yeah, I have.
do you feel that? The what? The tension?
But yeah, number 3. What is it?
DIY, do-it-yourself ortho. The DIY stuff comes from a good place. You know,
It does.
You're
They care.
taking initiative to solve your problems, which is inspiring.
Respectable.
Now, DIY ortho is a huge no-no. It's 100% no-no. Don't ever do it. It's not even like, oh, can I try? It's like, no, don't do it.
Right.
But I've seen these TikTok trends where kids are placing rubber bands between their front teeth because they have what's called a diastema. Doing these DIY ortho is that you're moving teeth within your bone. Depending on what angle, what forces, how much time you're allowing the teeth movement,
There's
So
so
many things
so
can
many
go
things
wrong.
can go wrong. The worst of it is you could actually lose your teeth. You
Yes.
could have irreversible root resorption because you're moving those teeth too fast.
yes. Final 2 things that you should never do.
You hear that?
Stop.
Do you hear the thunder? It's getting close.
Number 2.
Tongue piercings.
This is a good one. Tongue piercings can do a tremendous amount of damage. It could damage your nerve. You can have permanent nerve damage.
Yeah.
Trauma in the mouth because you have something that can split your tongue in half.
It can cause gum recession just because of the trauma on the gums that's holding the teeth. It can harbor bacteria.
A lot of complications arise from tongue piercings. That's a fact. Number 1 thing you should never do to your teeth.
Not receiving proper care.
It might seem like cheesy, here's two dentists talking about receiving proper care. It's the most important thing because all these things could have been mentioned to you when you were doing them, plus all the individualized care in your case.
At the end of the day, we're trying to save you from more financial distress later on, more complications later on, preventing what could be a bigger problem.
Right.
It would be worthwhile to care about your oral health as much as your systemic health.
Oral hygiene is sexy.
So sexy and aesthetic.
Can you not?